Assalamu alaikum. Welcome to yet another episode of Healthwise, because health indeed is wealth. The past 1.5 years has been very, very difficult for all of us nationally as well as internationally, because we've been suffering and fighting a pandemic, and it's not going anywhere anytime soon. All three age groups have suffered a lot due to this disease. Whereas the old ones were suffering and fighting the disease, the young ones were fighting a lot of economic strain and a lot of, they didn't know what would happen tomorrow. Whereas the young children, they were locked up at home, they had no school, they had no access to a normal education, as well as their parks were also closed down. So they had to be huddled up at home with no interaction, nothing to do, a lot of screen time, a lot of junk food. As a result, not only are they falling more and more sick, but they're developing these really strange habits where they're getting more and more depressed, they're depending more and more on junk food and screens, and as a result getting obese. And that is why we decided that today is the best time to discuss children. And who else could discuss children more than a pediatrician with us? So he was very kind enough, and I would like to thank and introduce Dr. Malik Kaisar. And thank you so much, sir, for coming over. He's a pediatrician and he's serving in a hospital as well as a medical center here. Thank you for joining us. And first, we're going to watch a little report on all the common issues that we see in children in terms of illnesses, and then we come back to Dr. Kaisar. So let's watch the report.
Or pediatrics focus on the well-being of children from conception through adolescence. It is widely concerned with all aspects of children's growth and development, and with the unique opportunity to each child has to achieve their full potential as an healthy adult. Unfortunately, even the healthiest baby can get sick. It is worth knowing the signs and symptoms of the common childhood illness as well as the treatment and prevention of these illnesses. There are a number of common childhood conditions such as mild infections, fever, organ disorder, or underdevelopment. But children are also subject to other preventable diseases such as the serious and potentially lethal infectious diseases prevented by immunization and dental care. Children development involves the biological, psychological, and emotional changes, and that occurs in human beings between the birth and the conclusion of adolescence. The optimal development of children is considered vital to the society, and it is important to understand the social, cognitive, emotional, and educational development of children.
Welcome back to the show, and let's ask now Dr. Malik all about children. And firstly, the first thing I would like to ask you is do you think this was the right decision to lock them up? Was it right? Is COVID actually affecting children? Because it was believed that in the first two waves, COVID did not affect children. But I assume the third wave is affecting them. Could you shed light on this, please?
Thank you, Dr. Taya. You invited me to discuss about the different issues of children, especially psychiatric problems and health issues. Yes, you have mentioned this is the right time to lock down. Yes, it's a right time, because in third wave it's also affecting the children and badly affecting, right? Especially.
So have you actually seen children suffer
yes,
from COVID?
Yes, in my routine practice I'm seeing different children with especially in breathing issues and pneumonia. They were developing pneumonia and breathing difficulties. Right?
So it's really true that it does affect children, and children need to be equally careful about it. So what would you suggest to parents about children care? How do they protect their children? How do they go about it that they do not catch this infection as easily and have the immunity against it?
Oh yes, although it's very difficult to confine children, to restrict the children at home. Yes, it's important to isolate or to keep the busy children, especially in studies, especially. And again, it's very difficult to tell you to decrease the screen timing of especially.
Yes, I understand that part of it. So what are the symptoms that a parent needs to be very careful about or look for in a child, so that they know that the child has not contracted COVID, and even, God forbid, if they have contracted it, they're not going the serious route? For example, how much should the fever be? Should they have some kind of breathing problem? What are those symptoms? Can you mention those symptoms of respiratory disease in a child?
Okay, yes. Nowadays, it's a common flu and fever and loose motion is also very common. But in COVID, it also very common in high grade fever, loose motion, vomiting. Yes, if the fever is more than 5 days and day by day condition is deteriorating, then you should go for a COVID test, right? If COVID test is positive, then go for there is a protocol to follow the treatment of the COVID, especially antibiotics and oxygen if needs, right?
So does the child start breathing very rapidly, and do we have to keep checking with his oxygen level with the pulse oximeter and all that, the usual protocols, or is it any different for children than it is from adults?
Yes, the same protocol, yes, to check the saturation of the child and breathing rate and fever pattern is also.
So what is the normal breathing rate? So for example, a child is breathing and you see that child breathing. So how many times a minute should a child be breathing? And if it's more than that, it's going to be an alarm sign?
Different ages have different respiratory rate. If normally it 24 to 30 is a normal rate of even in children. Yes.
And the fever, how much should what is the upper level
yes,
for the fever?
If the more than 100 Fahrenheit, then it should be considered a high grade fever.
And that's for consecutively for more than 5 days?
Yes, consecutive. Yeah.
What would you say to parents about self-medication? For example, should they be giving Panadol or some sort of antibiotic syrups or Brufen syrups to children without knowing their weight and age?
Antipyretic medicine you can use like paracetamol, ibuprofen, but not antibiotics without consult to doctor, right?
Yes. And what do you think is the reason why should we not be using antibiotic? Does it develop some kind of resistance in the children? Does it affect their kidneys or their their gut in some way, or does it not?
Yes, sometimes if it's viral, if you use antibiotic, it will deteriorate the condition, right? And first of all, we should diagnose whether it's viral or bacterial, right? If bacterial, yes, go for antibiotic, right?
Okay, so all the parents need to be on a lookout over there, and they have to recognize their symptoms of the child. So if a child has, for example, fever or flu, it can be due to multiple reasons. It might be COVID, or it might be due to some kind of bacteria or virus, and then they have to go and get themselves investigated by a pediatrician who will examine the child and then prescribe medication accordingly. What would you say about the prevalent viral infection these days? That's not COVID, but a lot of children are down with flu and breathing problems and everything else. So what would you tell about that? What do you have to say about it?
Yes, due to the change of the weather, it's a viral is very common. In every year, in this weather, is this flu, cough, fever, loose motion, vomiting is very common. But in these days is very dangerous because it decreases the immunity and it
makes you more
susceptible to COVID and other added infections.
So how do you build a child's immunity? What do you include in the diet? What suggestions do you have for the mother out there?
Yes, it's a good diet, especially fruits, vegetables, and protein, carbohydrate. Balanced diet is very important. To give fresh fruits, especially try to avoid from outside foods, right? Like pizza, burgers.
Right. But it's very hard to stop the child from having pizzas and burgers. So probably we'll have to teach all our mothers to go for very healthy substitutes. So you can make a pizza at home, but you roll out your own dough. The dough can be whole wheat. And with all that whole wheat, you can have all these vegetables, fresh, colorful vegetables, which you can probably cut into heart-shaped and different shapes and then bake them at home. So it becomes all the more palatable, colorful and healthy for your child. As well as where the fruit juices are concerned, you can always buy these molds where you can make popsicles out of fruit juices. So instead of giving them those packaged fruit juices with a lot of dyes and preservatives and coloring, what you can do is you can actually have like your watermelon or your strawberry, make a puree out of it, add some honey and have it in that popsicle. So you have they can suck on it all day and still they don't know that they're actually having that fruit. So having healthy fruit is important. What would you say about their sleep routine? How many hours should a child be sleeping, like a young child, for example, under 10 and then over 10? What would you say?
Yes.
How many hours of sleep and
Yes.
non-interrupted sleep?
Yes, in neonates needs at least 18 to 20 hours, but
Okay, all
above
right.
1 year of age, the sleeping hours should be more than 8 hours.
Okay, so one should be able to sleep like a baby while they're a baby, because once they're old enough, they're not going to be able to sleep. So it's all very important, as you said, sleep, and then about these chest infections. Can you tell a little bit about nebulizing? A lot of people are advised nebulization of their children when they have chronic cough or asthma or breathing difficulty, and then they're out with this, give this much of Clenil and Atom and all that. So what is all that about?
Without any necessary, you will give medication, it will be harmful for child health.
Okay.
Any medicine, even in paracetamol, without any indication you will give, it create a lot of problem for gastro, right? Like same, if you give the nebulization usually contains salt.
Right.
If you give more salt to the body, it can affect the kidneys, right? Yes, if child is asthmatic, in case of emergency, yes, you can use in good quantity, in accurate quantity, you can use which prescribed by the pediatrician. You can use, yes, you can nebulize, but not yourself.
This is a very important point, and the reason I mentioned it is a lot of people think that their child recovered due to nebulization, so they can suggest it to another child. And if the child is not actually suffering from something that requires nebulization, and if you're going to self-nebulize them at home, these are the consequences, and that's why we have to actually prevent that and not self-medicate. The second point, which is very common, because children pick up things from here and there, they're fond of eating out from anywhere and everywhere, so they get all sorts of gastroenteritis, and they start having diarrhea and vomiting. So how should a mother go about this? Like if a child already develops a gastro problem, then how does she go about it?
Oh yes, it's you're right. It's a very common. Usually, children at certain age start to take anything which take from any floor, or they put in mouth and develop loose motion and vomiting. Right? Try to clean these things if possible. Try to sterilize these toys especially, and carpet or floor in this area. Yes, once this develop, yes, you can start with ORS and probiotic. Yes, you can use. Yes, if it deteriorate this condition, then go for a special investigation or to consult a doctor.
So the key thing is that if your child does have diarrhea and vomiting, you don't have to let the child get dehydrated. So ORS is a must. So please make that ORS solution at home. And how do you make that? Distilled water, a little bit of sugar, a little bit of salt, mix it and keep feeding it to the child throughout the day. When he says probiotics for good health, so a little bit of bland rice, boiled rice, along with yogurt, because yogurt, or dahi as we call it, is very good for your gut, for the child's gut. So this was about gastro issues. Let's come to a bit of developmental milestones, so that all our parents watching should know that at what age should the child be holding his neck, what age should he be crawling, what age should he be walking, and what exactly is a normal development and what is delay.
Okay, yes, we can start from birth. Yes, sucking reflex or moro reflex, you can say start, it usually starts from birth, okay, right? And at the age of 3 months, the eye-to-eye contact starts, and 4th month of age usually start to hold the neck, and around about 6 to 7 months of age, they usually start to sitting, and 8 to 10 months, they started to walk with support, and usually at 13 months of age, they can run, or you can say this, they can walk with without support.
And what about interaction with people? So when do they start interacting? Because this is a very important point for parents to find out if their child is unfortunately autistic, towards the autistic spectrum or not. So what do we say about that?
Oh yes, it usually the best age is round about more than 1.5 years of age, 1.5 years of age, right? If baby is or child is not listening and not responding, then should be concerned to a specialist.
And at what age do they start speaking full sentences, for instance?
Yes, usually we can wait for maximum 3 years of age. Yes, after 3.5 to 4 years, if child is not fluent in speaking, then yes, immediately contact to speech therapist.
A speech therapist, it's very important for you to realize and understand if your child's tone is normal, if their gait is normal, if they have the normal reflexes that a normal child of their age has, and if they're doing all those things that a normal child does at this age. And in case they're lagging behind in any of this, you do need to visit your child specialist, your pediatrician, and then he will suggest what is required for your child, be it a counselor, be it some kind of physiotherapy, be it some kind of speech therapy. Coming to this, after this, let us discuss all about child vaccination, because vaccination has been such a big issue in our country, and people are so, I don't know what do they have regarding vaccine, and the moment polio comes up or something else comes up, people have their guards up. So how important is vaccination? Because people are just out and about, they think vaccine is some kind of foreign enemy against them. So how important is immunization for your child?
Immunization is very, very important for children. It usually it decreases the death rate of all over the world, especially in Europe is around about 0%, right? In our country is more than 60% if the child is without vaccination, right? Especially tuberculosis. In most of the countries, TB and polio, they eradicated from through vaccination. But unfortunately, in our country, and it's very common, and death rate from these two diseases is very, very common.
So it is extremely important that you have your vaccination card maintained and you make sure that your child is immunized against all these diseases at the right time and from the right place. Child development is a very important topic, and we as parents, we are responsible for our children's health. And we talk about all these physical aspects of health. Their mental health is extremely important. What happened during the lockdown was that the children were at home. They had nobody to interact with but the screen, and as a result of that they have become extremely depressed. We recently saw a lot of incidents in the US where a family of 6 Bangladeshi people were actually shot by their 2 teenagers just because of the depression. And every other day we hear of these depressing stories where children and adolescents just don't know where to release their energy. What would you suggest to parents regarding the children's mental health? What exactly should they do about it, and how should they go about it, especially in such difficult and challenging times?
Yes, no doubt we are passing a very, very difficult time due to isolation or due to the COVID. Yes, make the children busy, especially to make the children busy in study and cartoon and
I think cartoon would just be screen time. I think even when we talk about, actually what is unfortunate is even they're on the screen for entertainment, they're on the screen for studies, and that's what we don't want, right? So I think we should get into more physical activities with children, probably have some sports or games on our terrace or in our lawn, and it's not always about cross-infection. If we become our child's best friend, then they would not really be needing anybody else in life, right? Okay, a little thing before we go, I would like to ask you about fever and meningitis, because it's very common that the children over here come in with a stiff neck and it's already, past that stage where it can be fixed. So what would you say about meningitis and fever and all of that?
Yes, again I will come to the vaccination. The children who are vaccinated for this meningitis is a very less common this disease, and especially in disability in the children who are vaccinated. Usually vaccination we are doing for meningitis at the age of 9 months and 12 months of age. Yes, if you will not care, especially in fever and it's breathing difficulty, nowadays we are passing through, it can develop a high-grade infection and it crosses the blood-brain barrier and reaches the brain. Yes, reaches the brain.
Immediate hospital help is required, and if somebody is actually suffering from fever, they need to bring down the fever. So cold sponging, does it help, like all those cold towels on your head and placing ice in the groin and in the armpits, is it useful?
Yes.
Giving a cold shower, because what happens in our places is the mother actually wraps the child more. The child is shivering and the mother starts wrapping the child. So should she be wrapping the child up, or should she be giving him a cold shower or a normal shower?
Yes, you can give normal shower with lukewarm water, and especially if you want to do the sponging in children, recommended area is armpit, tummy and back.
All right.
Okay. Avoid to cold sponging on hands and feet, right?
Okay.
And especially on head. It is not recommended in children.
So you should do it in the armpits and the groin and the tummy. That's what
Yes,
you're
it-
suggesting.
yes.
So this is a very important point. Another point, when children have a lot of cough and it's prolonged cough, a lot of back exercises and a lot of back tapping is suggested. Could you kindly demonstrate how exactly should a mother treat the back so that the child is relieved of the congestion? And should she be giving steam or inhalation of some sort?
Yes, no doubt the desi totka is also very important beside this medications, right? Yes, steam is also important, and second is the back tap. You are talking about this in adult children is not very effective, but in neonates is a small age is very effective, and the position is should be on inclined position, right, and put on tap gently. In left side, on right side, you can gently you can tap. It helpful, especially in pneumonia. Not in asthmatic. Is effective in pneumonia or in mild infection, especially in the throat infection or in mild viral infection of the chest, right? But not in asthma, right? And keep the baby in lateral left or right position, gently tap on left or right side on back of the chest.
Okay, and what is the importance of breastfeeding? If you could just, highlight a little bit of that, because it's a busy world out there, and women don't have time, women don't even have the energy, and then, how they think and they believe that all these fortified formulas are much better for the baby. So what would you suggest about breastfeeding?
Yes, no doubt there is no alternate of mother feed. But now the time is changed. I have seen many children now they are become adult on formula milk.
Yes.
Okay? Yes, in some condition you can use the formula milk beside this mother. If mother feed is not available,
adequate,
yes, you can use
but
formula
otherwise
milk.
it's most ideal, and it boosts the immunity, because nowadays, immunity is the key word. We all need to boost our immunity, and for that, everything that we need to really take care of in terms of diet, it's the mother's responsibility. Give your child organic diet and make it more palatable, presentable, colorful. Make his lifestyle much more interesting. Talk to your child, have time for them, play with them, have some kind of exercise, outdoor activity, whether it's running, jogging, hiking. In Islamabad we have the hills, cycling. I guess that's going to really boost them up. And as far as the social distancing is concerned, it's not actually social distancing, it's physical distancing. We don't have to socially disconnect from people. We can actually still remain connected. And in our age, we used to have pen friends where we used to write letters to each other and feel very happy about it, exchange of cultures. I think we should encourage more that in children so that they are less and less depressed. So can you just give a departing message to all the parents out there, all the children out there? As a pediatrician, what is your advice to them during these times?
Michelle, you already have given a good suggestions, right? Again, I will suggest you to make the children busy physically and mentally both, right? Already you have mentioned physically, yes, you can give more time and play with your children. In a lot of indoor games you can involve in your children, and mentally you can involve in different screen time and yes, physical games.
So
right?
it's a good time to take out all those chess boards and those carom boards and revive all those, Ludo and snakes and ladders that we had, and Monopoly, and teach your children that this is what life is. Life is all about winning and losing, and life is not always going to go the way you want it to go. So you have to be prepared for it. This is a calamity. People have seen wars, people have seen floods, and we are in a time where we are seeing COVID. But it's always good to take care of your health and be very conscious about your health. Be a responsible parent and an even more responsible child. And I'm sure our program is watched by children as well all over. So they need to know that how they need to limit their screen time, because if they don't limit it today, then they're going to have faulty eyes, they're going to have memory problems, a lot of loss of creativity and everything else as well. Thank you so much for watching our program, and thank you, Dr. Malik, for coming over. It was a pleasure having you, and we wish you all a very healthy and and happy childhood. Thank you and Allah Hafiz.
Thank you.
Pakistan, Allah ka ehsan.